Tā tāua anau I runga I a koe tōku matakena. Teia tō o mara e te kawe e te kura ki teia nei au. I tōura I te tangata. Te rauka I a rātou te marama. Te kite e te whakari o te kura. O tō tāua mara e teia. Teia ka tumu ia no te kuki airani.
Kia orana. Previously, we explored how a vision for a smoke-free Cook Islands began more than 20 years ago through leadership, legislation, and years of public support. Now, that vision has taken root in the Pāinua. As of the 1st of June 2025, Atiu, Mauke, Mitiaro and Mangaia are officially the first islands in the Cook Islands to end tobacco sales. In this episode, we revisit the journey that brought these communities here and reflect on the commitments and actions that made it possible.
The Minister of Health today is Atiu, of course, Ngaputaru, and the Kaumaiti Nui is the same, from Mitiaro, Ngaputaru, and the former Secretary of Health, again from Ngaputaru, and of course Mangaia. So that's how, I guess, that's how it was planned. And of course, looking at Ngaputaru, I mean, these three islands has been really tight when it comes to national issues and matters that affects our people. So I guess that's how the three islands was identified.
Moe a te mai ki moa e toku araro, nā ratu mai e te tamai nea tātou, te riro ana e aratake no te tuanga o te parurumaki. Koia au mea te pai. O tōna mānokonokonga ki a kamata ia te oroma ki runga e tōku ino, tō tātou ino Mitiaro. Mi tāna rai a marama mai o te tai maki maata te me putu tātou I te kei te awawa. E aka nganga I te paruru I te maki. Pera katoa ko ki te mai ko te kai te muni e aka pou I ane ki a roko mai te tai awawa I kai I te aka pou te muni no te ahono e te ora mitak toko I te okay mitak.
The Pacific Ministers of Health several years ago set the target for smoke-free or tobacco-free Pacific in 2025. The strategy we've taken in the Cook Islands is to just continue to progress our agenda to go tobacco-free. And I think what's happening in Mangaia and Ngaputaru this year will help that. We were hoping in 2019, the Minister and I and our team were hoping that the Cook Islands would be the first to go smoke-free and declare that, or tobacco-free, even in Ngaputaru. But of course, we know we were diverted in achieving that because of COVID. But I think the rebuilding of Te Marae Ora has been great in terms of getting us back on track and progressing towards that.
From the first community visits in 2019 to expanded health outreach in 2023 and final consultations in early 2025, 4 islands stood behind the commitment to go smoke-free. Which means, as of the 1st of June 2025, these 4 islands will no longer sell tobacco, a first for the Cook Islands. In Atiu, the strength of leadership stood out. An island with just over 400 people and 34 known smokers. Both church and traditional leaders backed the plan, along with parents and students. The conversation was honest and respectful.
Na inua manu e kamata I te akakoroanga, karite akakoroanga o, warawe ia te ia, kamatai ana I te mataiti I topo ki muri. te tātou wā te atu tātou me roto I te maki COVID, te akatano kone, te akatika kone tō tātou kaweinga, no te kimianga I te rāwenga no tātou. Pati nei te tauturu a te iti tangata, no tātou kātotoa, ki a rauka te tai karoanga o, te tai uki o, te kā tupu mai e monomono tuatau, ki a riro rātou e au uki mātutu, meitaki te oranga kopapa, meitaki katoa I te pae o te api, te marama, te kite te pakari, e tauturu e apai a koatu tō tātou enua, e tō tātou pāsireia.
No runga I te manako te upanga I Atiu ake ne, kura wea tā mātou upanga, te Atiu Island Government, te mema kontara te Deputy Mayor, ki te tere o te minita, te minita ngā tete, Rose Brown, te Secretary, Bob William, e tōra o team te aramera, kura wea tā mātou upanga, no runga I te tere tēmai koe oki no te kimi te rāwanga, I te tautanga me kāre te kimi te rāwanga no te kimianga te rāwanga kākapea e raukai I tātou I Atiu nei I te karironga I Atiu as a smoke-free island. Ko te wairua e kone pera katoa, no runga I te kamatutu me kāre te kamaruri, I tō tātou ititangata kia kai I te manga metaki, kia kore tō tātou turanga kopapa me kāre te health, pūo I te makia, especially the NCDs and my thoughts about it. I'm very happy I te akarongo I amana ko me roto mai te tere o te minita e tōna pupu I te tarato I akakite ki roto te upanga te kone rato no te kimi te rawang e kakapea tātou.
Smoke free on our island is pretty good. It actually gives our youth and also our iti tangata something to think about for our future. And also our kids coming up, so it's actually our mitua now that's a role model to our future leaders. So this is actually helping our community.
Me kai koe te awa o tō wara nui poto rai aki mat ki tō o mate. Whakari te arara. Are o ki te me te aronga kai awa wai te arae me ka tutuki te arara ki ruto I arato.
On Mitiaro, a small island of just 155 people, community members spoke openly about the impact of tobacco. A church leader expressed his support by saying, "I'll stop this Sunday. We need to protect our children and I will lead by example."
Pai te tai au me te tai himu o mo tai ki ako te kai o wawang. Waro. Na te tai mea te karere ko yo ke te minita te tai mai 2019. Raware ko te teke tere I te kamariri e mātou I nukurua ni e kia karu ke mātou I te awawa. Ko tūrai o I tāra ko yo te to tātou community oro I te kakite e te minita. Ka karu ke o tako awawa I te ara. Ia pauna ia to o tere I tai mai e korua pinunga I te tua to tātou inoa. Te ara te mea umere kua kata awiri ko yo ki a Mitiaro ni. Ros mea ko kite rātou e tangata kai au. Tangata au kino me kare ako o. Pou te au ngai kātou to a Mitiaro ni iako te kimi au I te mea kare ako o. Me te iri a taime mai a karuke I te awa te taime anga ko yo ki te minita. E taime I ki te ara topataki ni tako o. Aka mita ki o te atua.
Kia ka mita ki te atua. I oronga I mai kia. Kia riro aka kita ki te atu I te tūranga. O tā mātou iri kāpua te irawi I e mātou I roto I te ara. Te mea muara. Kia ka mita ki atu nei. Te tamaka aere. Ko iau te tekeretere o te marae ora. No te apai mai te tai kura. Mānea. Ia māramatu te iti tangata e. Me te a te tūranga. Tā rātou iri kāpua e irawe I nā roto I te ara. I nake anga te iti tangata kuki aere ni e. O te tai iri kāpua matahara teia. Teia te irawe I ki runga nei I te inua. I te mea kua ki te ia mai te tai au tūranga. No te akamaro iro, e te akamatutu, I te ora anga o tā tātou tamariki. E tupu mai nei, tā tātou tamariki e tupu mai nei. Ua atoe kua pauto tātou tuatau. Ko ki te ia mai te omaki. Te nāruto mea na tātou i te au takainga. Karakara i te tuatau. Te pai mai nei te marae ora i te tai tūranga o. Kakapea tātou i taka mātūtū anga. E taka maru i anga. I tātou ua orai. No tā tātou tamariki no apupo.
Tā kui manoko nonunga i tā tātou iri kapua nonunga i tā te marae ora i rawe tiara. Mata ora au. Pera katoa e ki te turai koe mata ora rai i tāta pēni e umarama te taratara maanga te kere tere te umanoko i uri i ana. Are tia no tia teimi uri i ai. Ku uri takari i ana tia manoko te o ki o umeni ki te i tāta. Kia karakoro ho te i tāta kia katatara ho.
On Mauke, where the smoking rate was highest, out of 300 residents, 70 were identified as smokers. The call for change was urgent.
Mataura tskato mato arawe anga e pera kato e te ara ko rawe e tarato iri kapua e te ia e nei e te oire kimianga tau e te hall i kaptirangi e tōna staff katoto te au tumana koe tuku i mai kirunga kare atu kare mai e karanga nao ki a koe it's an angel sent to Mauke. It's a new day, it's a new beginning and it's a change. No tō tātou i te tangata katoto atu kuki airani. Te au manako kua kitakeran tātou. I te tuataura, te a kaoraora ko ia mai nei. E me takerai no tō tātou ora anko papa. Pera katoa, no te uki, te o tamariki tā tātou o tamariki. No rātou te ora iti mai nei. Kia mako tō rātou ora anga.
I salute the team from the Ministry of Health for bringing this program out to Akatoko Manawa. And they've been out there, addressed just about every area, from our children at school right to the elderly. So I applaud them for what they've done. We have in our hands the choice to do the right things, to lead a healthy life, and if that's what we want, then we won't have any problems, none in Mauke.
For Mangaia, with just 471 residents, over 71% of adults are affected by NCDs, and tobacco remains one of the leading risk factors. For Mangaia, the time for action had come.
Te tere o koto I ara mai runga nei te inu. Ko riro I te akamaru ilu I mātou te aronga e ka tere nei runga I te inua nei. Mea mātou te Island Government, tō te aronga manatua e pera katoa tō te au putuputuanga te au e kare se tuki kei runga I te inua nei. Ko riro I a kauraura I mātou roto te tuata nei, te au karere tako tu I pai mai roto I te popungi o nei.
I don't smoke, but I'm going to try my best to put myself into their position of, I think there will be a little hiccup, along the way. The impact that we working on the non-smoking, in here on Mangaia, a lot of especially the papas, they pretty much feed on that. I think in the future, in the next 5 or 6 years, it's gonna really work here if we continue not bringing any of these cigarettes on the island. Yeah.
Although I am currently a smoker, I do believe that this is something that we need to address. Perhaps now that I'm a member of the task force will be the reason that I quit smoking again. I do think that a smoke-free Mangaia is a good thing for us and for our future. I'd like to see less and less of the younger generation falling into this addiction, and if there's anything that I can do to help that, then that's something that I need to do.
Mataora I te epitoma I a koto I te ere mai, no te metama koto te ruirua, arawira wa koto te oromitua. Nā rau te ka mitaki I koto no te mea ka tai aku ku uipaanga consultation meeting I tupu I te oromitua. E norunga I te manamana tā o te awa, te kawa, I runga I te tua te enu.
Mataura wari mai koto kimi te mana ko te oromitu. Tōku reka reka te no te mea o te tae tuanga te karuko I te tūturu. I te ia mana tārutunga nei te tua te enu.
When I took on the role of Secretary of Health in 2018, even prior to this, there was always that thought behind how do we reach the people? You go through your community structures, you go through your ariki, the churches, and of course there's government levers as well. Looking at the community and the enthusiasm and the way that community actually make things work for us. We sit in government, we try and set policy and provide resources to support this, but when your community is standing behind you, then that's fantastic.